Good evening. Right now, here is morning 5:30, and it's cold here. So I'm Tibetan doctor, as you all know, and I have more than 34 years of experience, clinical experience in Tibetan medicine. Uh, in the past, I worked as a research director of Menla for 12 years. And for the now last more than 21 years, I have been working as a clinical doctor at my own private clinic known as Qusar Tibetan Healing Center in Dharamsala near Nobulinga with my wife, who's also a Tibetan Amchi. So we have been treating here with our own herbal preparations. Not just with that, we also treat people with different kinds of external therapies over here with the Tibetan medicine. And during past many years, I have been also traveling overseas to Europe, to Germany, to America, and to many different other countries to hold many different kind of workshops and seminars, as well as training my private clients all over these countries. And often, especially in Germany, I've been traveling for many years and working there with my friends in different parts of Germany, in different clinics and hospitals, where I've seen many people suffering from these seasonal affective disorders, especially among women. So today, I would like to share my experience and would like to give you my suggestions and solutions what Tibetan medicine can offer uh, for this kind of problem. So thank you with a small introduction.
We're very honored to have Amchi Qusar. Amchi is the Tibetan word for doctor, and I'd like to use that Amchi Qusar interchangeably with Dr. Qusar. Dr. Qusar has actually been awarded a gold medal in alternative medicine by the government of India. So very, very honored to have somebody so experienced. And I know speaking to Tibetan medicine doctors on my app themselves, they really highly regard you. And so it's such a great honor, and very grateful that you have volunteered your time and expertise to start off this inaugural series on Medicine Buddha Anywhere. So thank you, Amchi Qusar. So just by way of introduction, my name is Tenzin Metok. I'm a Tibetan from London, and I'm a mother of 3 children, and I'm the founder of the Medicine Buddha app. I'm a lawyer by training and a banker by profession, and I took a career break in 2019 to make an app called Medicine Buddha, and it came from a real life need to connect my mother-in-law, who suffers from insomnia, with a Tibetan medicine doctor. And I found a lot of difficulties finding a Tibetan doctor who is, properly qualified, has been vetted, can speak English, find them on the right time zone, connect them together. And then once connected, I found it very difficult to receive the supplement suggestions. So it came up with this idea that surely somebody could put this on an app, and make an app where somebody could view the profiles of Tibetan medicine doctors and book an appointment at a time convenient for both the doctor and themselves, and have the consultation online, and then also receive the supplements. I pitched this idea to an entrepreneur competition by His Holiness the Dalai Lama called the Tibet Innovation Prize. I was a finalist, and that's where I actually did meet Amchi Qusar in person in Dharamsala, and he kindly agreed to come on as the clinical lead, supply us the supplements of the very high standard, and always provide all his insights and expertise to further Tibetan medicine. The next hour and a half, we will aim to explain the history of Tibetan medicine and healing. In Tibetan medicine is called Sowa Rigpa, and it translates into the science of healing. We'll share its ancient origins, how it's practiced today, and how we see the future of Tibetan medicine. And from Medicine Buddha, how we want to expand the reach and influence of Tibetan medicine to those who actually would benefit the most from Tibetan medicine. The main topic on seasonal affective disorder will go through its symptoms and diagnosis, Dr. Qusar will explain what Tibetan medicine offers on seasonal affective disorder, especially with Tibetan medicine having this focus on mental wellness and a very holistic approach, a holistic natural approach to treating that condition. Amchi Qusar will also present a case study of a recent patient who he's treated successfully, and we'll also make diet and lifestyle suggestions for those suffering from seasonal affective disorder. The last half an hour is allocated to a live Q&A sessions. So if you should have any questions throughout this presentation, please could you save it towards the end. We'll open the floor for not a personalized question, but any general questions you may have on seasonal affective disorder or any part of Tibetan medicine or anything that sparks your interest throughout this presentation. And that's so that it would benefit the most number of people who've zoomed in this evening. Before we begin the presentation, I'd like to take a moment to acknowledge depression, because depression, it can come in various forms. There's a whole spectrum, can come from a passing blue mood to, real severe medical conditions like major depression or manic depressive illness, which requires extensive treatment. So please use this presentation, as an educational tool. We are sharing Tibetan medicine and healing's view on seasonal affective disorder and aspects on lighter forms of depression. Any of the techniques and supplements described here really should not be used in any way as a replacement for professional help. We would encourage you, if you are interested in Tibetan medicine, to seek a consultation with a Tibetan medicine doctor to have that real personalized approach and a real holistic view of your condition, and also a personalized treatment plan. What we do know about depression is that, it's a combination of a lot of different factors, genetic, environmental, etc. We do know some things that depression seems to affect women more than men. And also Amchi Qusar is using a case study of a woman who suffers from seasonal affective disorder. So please take what you can out of this. If it helps you with self-care and great health and natural health and holistic self-care tips, great. But please do seek professional help where you feel you have a serious medical condition. We'd like to dedicate this presentation to the promotion of Tibetan medicine. As I spoke before, my purpose of making the app was that we increase the access of Tibetan medicine, especially to those who don't know anything about Tibetan medicine but are very open to Tibetan medicine. Tibetan medicine is practiced in India, Nepal, Mongolia, China, in the Himalayan region, and that's literally half the world population. But it's so unknown here in the West, in Europe and America, but growing in popularity. And we're doing these type of talks to promote Tibetan medicine. We want to help all Tibetan medicine doctors, whether they're on the app or not, because we feel that Tibetan medicine is bigger than each one of us. It's an ancient form of healing that, we want to expand its reach and influence. And if it helps other Tibetan medicine doctors, it will actually help those who can benefit the most from Tibetan medicine. Secondly, we're doing this in partnership with Tibet House USA, Menla, because we partnered with them early in this year with a unique sponsored doctor screen on the Medicine Buddha app. It's here on your right, and that allows anyone to download the app and make a donation towards a scholarship fund for a Tibetan child to attend Tibetan medical school. This is a 5-year program run by Mensa, which is the Tibetan Institute of Astro and Medical Sciences, and it costs in Indian rupees 500,000, which is equivalent to around £5,000, and it's a figure that can really empower somebody with a livelihood. And every cent goes directly to Tibet House USA, who roll it out. And personally, I would love it if we could sponsor a Tibetan woman to qualify as a Tibetan medicine doctor. And hopefully in 5 years' time, they'll have a job on the app or be working at Menla. It really would be quite full circle. Diving straight into what is Tibetan medicine and healing. Sowa Rigpa, it's a very ancient 2,500-year-old system of healing. It's really amalgamated a lot of, even Vedic and Indian Ayurvedic knowledge, and also Aboriginal Tibetan knowledge of herbs and plants to come up with actually one of the oldest forms of psychiatry. There's this real focus on mental wellness. And you can also see that in the Tibetan culture and how calm and resilient Tibetans are over generation, because it's so embedded in our culture as well. And it's a form of lifestyle. It's a form of integrative medicine, and I purposely use the word integrative rather than alternative and complementary, because it really uses, combines with whatever treatment plan any patient may have. A lot of the supplements are all natural, herbal based, so they don't cause any side effects. And a lot of people are turning to Tibetan medicine as a form of integrative medicine, complementary medicine. And we hope this type of presentation will actually just increase people's knowledge and make people want to be more interested and learn more about Tibetan medicine. Unique to Tibetan medicine is a few of the practices such as pulse reading and urine analysis, and really making a personalized holistic system of healing. So they're not just looking at the individual, but also what environment the individual and what community can do to also support in the healing process of the patient. Tibetan medicine doctors will use recommendations such as herbal, physical, nutritional, dietary, behavioral, psychological, spiritual, and external therapies. These are, cupping, moxibustion, hot medicinal baths, etc. And Amchi Qusar will actually go more into the specific therapies and supplements that are tailored for seasonal affective disorder. A consultation with a Tibetan medicine doctor could include urine analysis, pulse reading, observing what the tongue looks like, and history taking. On the app, of course, we don't have the pulse reading because it's a video consultation, but we can take patient history, we can observe the tongue, the urine analysis, and just history taking for the patient. So we're bringing Tibetan medicine and making it more accessible via leveraging technology for good. Unique to Tibetan medicine is a focus on 3 humors, and Amchi Qusar will give more detail on this.
Yeah. Now, since the topic today is regarding seasonal affective disorder, it's really very important to first to understand the basics of Tibetan medicine and the theory behind the seasonal affective disorder. See, the 3 humors are just nothing. It's just the body energy, the body heat, and the body mass. You see, the problem that we have nowadays during winter time, which is seasonal affective disorder, often the depression is the main problem. So what happens is that there's a disruption of this dynamic harmony of 3 humors, the lung, chipa, and pekin. The lung means the air, which means it's the main energy source of our body, whereas chipa is the body heat or the fire element. So it is like the protein that our body needs to regenerate all the time. And whereas pekin is the body mass, all the body, the fluid, such as the muscles, the fats, etc., which we have in our body, is pekin. So what is happening actually in this seasonal affective disorder is that there's a disruption of this dynamic harmony, whereas due to excessive cold weather condition in winter, the pekin increases a lot. That means when pekin increases, that means the body, the fluidity, the water, as well as the earth content becomes excessively working and therefore accumulating in the system. Whereas Tipa, the fire, the heat is lessening, it's decreasing in the body. So when there's less of heat in the body and excess of water or the cold conditions in the body, then lung, what happens is that the lung helps to increase the pectin and decrease the TIPA. So therefore, people who are genetically or predisposed uh, predisposition by their kind of but normal character, if they are of pectin type or lung type, then such kind of people suffer from uh, seasonal affective disorder. So therefore, lung, tipa, and pectin looks like a normal energy, but they always react to the changes of the season. So we have in Tibetan medicine that the lung has its own kind of a time of accumulation, manifestation, and alleviation. And similarly, tipa has the same thing, and the pectin. Whereas pectin in winter time has its maximum accumulation in the system. That means the body increases too much of cold. So when we think of excessive pectin, the seasonal affective disorder means that it not just only causes depression, but it also causes kind of a cold organs such as kidneys, such as urine bladder, and things like that. The organs and other tissues that are normally cold in nature to increase that coldness, and therefore the body feels that changes. So therefore, lung, tipa, and pectin always work in a dynamic harmony during the time of the day and night, as well as the seasonal changes, because in Tibetan medicine we say that season is one of the time factor which causes all kinds of disorders. So such as we say that the behavioral factor is very important. So three humors normally changes and affects when there is a change of the season. So we will discuss more regarding the seasonal affective disorders in the next slides. So this is a little bit of introduction to the three humors for you all.
Thank
Yeah,
you,
thank you.
Amchi
Yeah,
Kusala. I understand these are the foundations, the three humors in Tibetan medicine. What are some of the personal characteristics of somebody who has more like a lung personality versus Tipa versus Becken? I've been told by
yeah,
other aunties that I'm
that's
more
a
like
good.
a Tipa personality.
Yeah, the air element have excessive, as just we have in the slides. It's excessive emotional problems. Lung people are very vulnerable, susceptible to any kind of changes. So when the body develops too much of cold in winter time inside the thermodynamic or the thermostatic level becomes too cold, then lung starts to increase. And whereas our body is not just, it's not just a physical thing, not just like a car or anything like that. Our body is really very complex, because right from the beginning, we in Tibetan medicine we believe that from the time of conception, there's this very subtle energy that joins our body, and where thereby conception takes place. So therefore, this continues throughout our life, and whereby the emotional things plays its role. And when there's emotional problem, then the lung people are very often becomes negative. When there's a strong kind of pressure, they feel the stress. When they feel the stress, then the body lung, especially the basic lung qualities or basic lung characters, they really get disturbed. So therefore, then it disturbs the digestion, then it disturbs the sleep, then it disturbs their they get the moving pains. The pains they can feel the pain any in different parts of the body. So therefore, so that begins with the simple psychological emotional problems, and then it when it goes down deep, then it runs into very aggressive emotional problems, and which we can call this as a very you know strong soklung, or nyinglung, which is the one that affects the heart, and also the life energy, the life channels get disturbed. So therefore, lung is very important, because lung is the one which normally is good when all the fire and the water qualities are working well together. when they are not functioning well together, when the fire and the water qualities don't function, the air also can disturb the both functions. So therefore, lung is considered to be very, very important. And then in winter time, especially during winter time, the seasonal affective disorders increases when somebody belongs to a lung kind of characteristics.
Thank you. That's really, really helpful.
Yeah.
Going back to the foundations of Tibetan medicine, we've got a picture here on your left of Chakpuri Tibetan Medical School. There's a few different schools of Tibetan medicine. The most popular one is Menzikang, which I said before is the Tibetan Institute of Astro and Medical Sciences. The one on the left is Chakpuri in the set up by the 5th Dalai Lama of Tibet. And the 13th Dalai Lama also met the Menzikang in Lhasa in 1916. In 1961, His Holiness the Dalai Lama, the 14th Dalai Lama, set up a Menzikang, re-established Menzikang in India. And the future, 2019, I set up the Medicine Buddha app, and we wanted to bring all this ancient knowledge and of healing, which can really benefit a lot of the modern conditions like seasonal affective disorder, like insomnia, allergies, arthritis. There are a lot of modern conditions caused by our working arrangements, how much processed food we eat, our lifestyle choices that could really benefit from having this ancient healing. And just anecdotally, if I could share my journey into natural medicine and holistic medicine, my second child, my son, suffered from eczema since he was 2 months old. And he actually, one of the most traumatic experiences in life is that he had infected eczema, and he was in the the isolation unit in the hospital. And I remember going to speak to a pediatric dermatologist, any specialist in the Western conventional world, and I was really frustrated with conventional medicine because all the general practitioners kept saying to me is put hydrocortisol, and they would always just increase a dosage of hydrocortisol. And I felt really that a lot of conventional medicine, especially in the West, it's kind of like a plaster on top of and attacking just the symptoms. And I did, as any mother of a sick child would do, is just research and found that, allergies and eczema are correlated. And so I worked on, his allergies, his gut health, loads of probiotics. And I spoke to a Tibetan medicine doctor who did a lifestyle review and looked at, the food that my child ate. And she said, avoid ketchup, avoid citrus food. And I found it really interesting because then I went to a Harley Street pediatric dermatologist who actually said, avoid these type of citrus food because they consider high acid food. So it completely matched, this ancient knowledge with modern conditions, combining, what the Tibetan medicine doctor said with the specialists in the Western world as well. And I benefited a lot from that. And, we hope that we can bring all this ancient knowledge, like what Amchi Qusar is speaking on, to benefit people in our modern times. What is seasonal affective disorder? It's a type of depression relating to change of seasons, particularly in the winter months. This is where you have very few, less sunny lights and shorter days. A lot of people say they suffer from low mood, blue mood, the change in sleep patterns, insomnia, change in appetite and weight. They feel sluggish, low energy. I actually have a patient who said that they find like their fingers and feet are very cold during this period, and they stay cold, and they always need some sort of supplements with this. And she said she does feel very low during seasonal during the winter months. Amchi Qusar.
Okay, so now it's me, the Tibetan medicine and its SAD diagnosis. So what happens is that often during winter time we have major problems with the lung when it's too cold. During the time when I go to Germany, I often visit Germany in winter time. And in winter time, often, most of the time, I've seen my women patients who have cold hands and feet, and who have complaints of sleeping disorders and moving pains. And often, when I see them, they manifest a lot of lung disorders. So SAD problem, according to Tibetan medicine, is a disturbance of lung disorder that often leads to mental instability and depression. And that's that for sure. I've seen most of them have a symptoms, not really very severe, but even a minor depressive kind of a state was there. and and they really feel, like moving outside their own country, like often in Germany when I visit in winter time, they feel like moving to some warmer place, like in India, to go moving to Goa or to sea beach, or to have a sunshine bath. So that was the kind of a beginning of a mental instability, of the emotional disturbance was quite prominent. And when this lung kind of instability becomes worse, then we call this as a sok lung. Sok lung, sok means that sok is the life energy. Lung means the energy, the lung, the energy that holds the life. So whereby it means that the major blood vessels, the major the energy channels in the body are disturbed, and therefore uh, a lot of worry, strain due to the overwork, due to time constraints, and due to cold weather, or not reaching to the time to the job, and things like that. And then moreover, the anger, the sudden kind of shocks and fear, all kinds of anxiety that comes up, can lead to the Sokrum disorder. So especially in winter time, it's not easy to manage everything, like during the warmer days. So therefore, when things becomes difficult to manage, the lung personality type especially becomes very vulnerable. When they become very vulnerable, then because things goes directly into the emotion, then they become difficult to control the emotion. So therefore manifest all kinds of psychological disorders, oversensitive any kind of changes, and was not able uh, to they were not resilient enough. So therefore they develop all kinds of anxiety, and not just anxiety, especially panic attack, and all kinds of negativities, emotional negativities, then comes up one after the other. So therefore, these seasonal affective disorders affect those who already have a depression. Actually, according to our Tibetan medicine, as I mentioned earlier, that the lung, tipa, and peken, the body heat, the energy, and the mass, they react all the time, with the changes outside and with the changes going inside our own body and the mind. So what happens is that when the weather becomes too cold, especially those who have a kind of rheumatoid problems, can react to the changes of weather outside. So they may feel kind of pain in the joints, and then some people also are allergic to changes of weather conditions, like if they react like allergic rhinitis, or people who have flu symptoms. Often in wintertime, some kind of things may show up. So when such a kind of physical weakness manifests, then it goes deep into their depression again. It further deteriorates their emotional problems, and then they really become, unstable in their way to manage everything by themselves. And moreover, when the body heat, the TPA goes down and PECAN increases, then it's really very difficult to manage that, because often what happens is that we feel quite warm and happy when TPA is increasing. Of course, TPA must not increase it at its more than normal level, but if it is at its normal homeostatic level, then we really feel nice, So therefore, people who are lung type and have a lung kind of problems, plus the PECAN problems, what happens is that in such a condition, what happens is that lung initially increases the PECAN, But when pain increases, the coldness increases, then what happens that some people manifest kind of a fatigue syndrome, kind of lethargic conditions. In that condition, then there's a level that lung decreases and packet increases. So therefore, uh, when the lung decreases at the time, then your body doesn't have enough energy to go forward. So therefore, feeling sleepiness means kind of excessive cold. When you want to sleep, you want to sleep not just without clothes. We have to put more blankets one after the other. So if there's a sack of cover up and want to sleep, that means you want to generate more heat inside the body, so then you feel comfortable. But what happens is that inside your body, the body develops too much of cold in the system. So therefore, you know like for example, in winter, especially in America, as we all know that many millions of Americans suffer from this seasonal affective disorders, means that there's not much sunlight over there. So the sunlight is nothing but it's the heat, it's the warmth. So what is important is that we have to generate this heat within ourselves. If you generate more heat, then the lung will increase, and then when the lung is active, then the pain will work more, and therefore we will have decrease of pain. When pain decreases, then we'll be able to overcome this kind of seasonal affective disorders, or keep ourselves warm enough. Keeping warm enough is very important. Not feel cold. So warm inside in your heart, warm inside your body, and warm outside. Keeping warm outside, in a house is very, very important. So therefore, psychologically, we manifest, like often I've seen in Germany, many women who come to see me, they say that they really have cold hands and feet. And I ask them, what do you eat during the winter time? And they say, I often eat, because they want to maintain their body weight, they want to control their body weight. They say, I only eat salads, I eat cold foods. And then I said, no, this is really not the right thing. You better change to warm food in winter time. Eat warm food, boiled food, warm soup. If you're not vegetarian, eat some meat soup, fish soup, whatever, and drink plenty of cold water and ginger tea, etc. Things like that. Then you will really feel change. And when the people come again and see me, then they say that, yeah, that this is really good to eat and drink warm things. So therefore, in our Tibetan medicine, whatever you ingest makes a big difference. So taking some warmer things and keeping warm all the time is really very, very simple and important thing to to react to this kind of seasonal affective disorders. And moreover, often people who have excessive lung, they manifest coarse skin textures. Not just coarse skin, but when they have just Medola has mentioned the eczema and all other kinds of skin disorders, especially the fungal disorders, they really get worse during winter time. So when lung increases and pain increases, this skin reacts more. Lung, in our Tibetan medicine theory, we say that the skin is the one which reacts to emotion. And often in my clinical experience for last many years, I really give very good counseling to make people feel positive. Whenever they come to see me with a fungal infection with the skin, fungal infection on their hands and then and their neck and their elbows, I'm first making sure that they make themselves positive. And once they make feel positive, then they after some time they really feel much change. There's much change. Their skin really texture becomes very smooth and quite clear. So no more coarse kind of skin texture after that. And then the quick heartbeat, dizziness, insomnia, loss of appetite. These are quite common, but not just loss of appetite. In winter time, the craving for food, the craving for warm food, and not just craving for warm food, but craving for sweet things, like mostly like carbohydrate. So what happens is that when lung disturbs, people feel like taking sweet things. and also lack of coordination and
And
accident
here,
proneness.
I wanted to also just kind of focus on this the loss of appetite or craving for food. It seems like, two extremes. And it is, either the loss of appetite or the craving for food, that it's extreme kind of food patterns, right?
That's it, because the lung often can go to two extreme. So sometimes they don't feel like eating because a change of mood, when mood is quite down. Once when they feel warm enough, then they feel like eating because they think that their body is warm enough to eat, to digest more, to feel like eating more. So therefore, craving not just for food, all kinds of food, but sweet is the main thing that they crave for so much. Okay, so therefore, and then what happens is that the tongue, in Tibetan medicine, we diagnose the tongue because the visual diagnosis is important. Often people have a kind of a coarse tongue. They feel rough. Then when they move their tongue, touch the palate, they can feel the dryness of the palate, and then there's a crackdown in the middle of the tongue as well. So tongue becomes more coarse and it becomes more dry as such. Yeah. So now, as far as Tibetan medicine and the suggestion of treatment is concerned, so a combination of dietary supplement and not just that, we use various kinds of therapies. Then and even like in the West, it's people have a trend to use incense in nice flavors inside the house. So the incenses are good, especially that we have in Mensikang and Agar 31 incense is really good to soothe you down, to keep you calm. And there are various excellent therapies like moxibustion and also warm hormone therapies and steam baths and of course natural kunya massage. And these are really very useful in treating lung. So because when you treat lung, then it's better and easier to manage these seasonal affective disorders. Now what
And with
happens is that
COVID,
uh,
and with
yeah.
COVID, if travel is possible, Menla offers these external therapies.
Yeah, so as far as other treatment is concerned, food and behavior, using various kinds of warm foods and soup is very important. Well, like warm food means, drinking warm water, drinking, green tea, or drinking any kind of tea or milk is advisable. In Tibetan, we say there's four nutritive things that we use in food. One is molasses, the jaggery. So you can drink more jaggery, as it put in a tea with ginger, and because ginger is helps to improve digestive heat. And if you feel very nervous and kind of a moody, then it's good to add some nutmeg and also add some kind of a spices like clove or or cinnamon, etc. In a drink. These you can prepare this yourself, and and also it's good to use add a little bit of if one feels cold, it's good to add some the if possible fresh butter. Otherwise, the butter, the cow's butter or any butter is really good to could add because it increases warmness. When the body becomes warm, you'll feel calm. When you feel calm, you feel like managing things easily. So therefore, it's good to manage lung by keep eating and drinking warm things and keeping warm. And so therefore, staying in a warm and dark, cozy room and listening to a nice music, etc., or listening to rituals or doing some pujas, things like that, is really very important. And when we go out, it's really very important to cover your hands, cover your ear, cover your face. You need just to look outside where to go as dressed. Just cover it warm because once you get cold, exposed to cold weather or cold winds, then lung may increase extremely, and then once you exposed too much to the cold, you may get flu symptoms. And then once you get flu symptoms, you feel cold chills. and then this kind of symptoms or the winter kind of depression may increase due to this coldness. So it's very, very important to keep warm. If possible, when there's a sunshine, expose yourself to sun, go outside and take a sun bath whenever it's possible in winter time. Otherwise, when it's not possible, stay inside and keep warm. Do a lot of exercise, and that's very important, but not excessively to warm you up. That's very, very important. And not just that, because when you really feel vulnerable and then you feel disturbed, it's good to consult someone who can guide you. Especially in our Tibetan culture, we consult lama for when you really feel weak, mentally weak, and unstable. And you can also consult the Tibetan Amchi as a form of psychotherapy, because it's very important to manage your emotion, to keep it positive. And it seems difficult, but if you really know how to manage it, it becomes so simple. Just take a whenever a problem comes up. Sorry, my doggies. Whenever problems comes up, you just take time to manage it. And once you find a time, the time will tell you how to manage it properly. So therefore, there are many simple methods that you can manage your emotion, and then breathing exercise like yantra yoga or any kind of like a normal yoga, will help. And in our Tibetan treatment, we often have a cupping, acupuncture, and masturbation, kunya massage, and hot medicine bath, etc. Which is the hot medicine bath it contains of 5 nectar herbs. So these are the herbs that we use to treat season affective disorders.
Thank you. That was really helpful.
Yeah. Now, as far as case study is concerned, I have a patient, American patient, who recently moved to the United States, but she has been in India, and she often have in winter time uh, the symptoms. Of course, the strong depression and mood swings, and she often have a kind of a lower back pain, and also have her symptoms get worse during winter time. So for last more than 2 years, I've been treating her, and she really, really has changed a lot. But now she has moved to United States just recently because of the visa issue. I hope she is fine, because now it's winter time. Because she said that often she really has problems. So, but as in India, because she really wanted to move down to Goa, because during the lockdown period in India, especially in Dharamsala, it was cold. So she moved down to Goa to have a sunbath. And then because of this visa issue, she now has to move to the United States. Hope she is doing fine, but she's one of my kind of a example, that she is 60 plus and has more, responded to all kinds of treatment that I gave. I gave her many times acupuncture therapy, many times moxa therapy, many times kind of a golden needle as well, and many times cupping. So, and often all kinds of medicine that I gave, she responds always so well. So she's one of my most happy clients uh, taking Tibetan herbal medicine.
That's fantastic to hear. And you actually shared with me that initially, when she came for her consultation, she came to you once every 2 weeks, and then you
Yeah,
said that slowly she actually started to see the benefits herself, and then continued with the treatment. I think that would be quite interesting for you to share. Her change from starting the treatment to what you saw progressively.
yeah. Yeah, so that's one of the condition. But see, she's not a patient of a depression only. She's not just a seasonal affective disorder. Means not just suffering from depression. She has all kinds of physical problems. Like she has a pain in her sciatic nerve. She has a neck pain. She sometimes get migraine, and often emotional ups and down. So therefore, all these problems are problems of winter time, especially in winter time. All these symptoms comes up together. So we have to manage not just the depression, we have to manage all these uh, minor as well as major symptoms together.
Yeah. And that's what you do, right? When you make
Yeah,
the recommendation for the supplements, you carefully calibrate it for her
yeah,
age, her
that's right.
condition, her
Yeah,
physiology, but also any of the other conditions you have, so that the supplement, it will also treat the mood swings. It will also
that's
treat the joint pain as well as the seasonal affective disorder. So I think it's really important that to emphasize the personalized prescription when you have a consultation with Tibetan medicine doctor, is that they look at everything that's going on, what other conditions you have that needs to be treated, to carefully calibrate that, you have 3 of this or 2 of this after lunch or before breakfast or half an hour after dinner, that it's really a personalized holistic system of healing for you.
So, as far as supplement suggestions are concerned, we have here, two main supplements, which is known as SEMDE. SEMDE means Deva means healthy or happy. You can call it both, and SEM means the mind. So, it's the name of this pill, which makes your mind happy or which makes you, you know, stable, so to say, emotionally stable. So and then it is the kind of a Tibetan medicine that which can relieve all kinds of stress and anxiety.
It is
So
actually
someday,
one of the popular medicines on the app as well. And I know that it's got some really interesting ingredients that actually help purposely, right? Specifically for stress and anxiety. Would you be able to, just highlight 1 or 2 of them?
yeah, see, we have here two, one is Samte and another one is Nyinglung, Nyinglung 8, which is we have Allu, or it has different names. This is also one of the primary kind of a supplement in Tibetan medicine for balancing the lung, or to help the heart, because in Tibetan medicine, heart is not just the organ, but heart is the organ that where our all kinds of emotional kind of a imprint stays there. So therefore, our heart reacts to the changes what's going on inside as well as inside due to emotional disorders. So these two, Semde and Nyinglung 8, contains many important herbs. For example, such as like we have we have the nutmeg here, and also our body needs to warm up, right? So in order to warm up, we have the kind of a white betel nut as one of the chief ingredient, and then we have the cloves, and we have a fruit known as ning shosha, which is kind of prunus type. This is one special kind of a fruit, which is also used for various kinds of preparations in making chilies or pickles. We call this ning shosha, which is especially good for the heart. And then also we have ruta, which is sasuriya lapa. So these are the major kind of and then also, if necessary, you can take it with the honey as well, and you can use it with the molasses. Because often Tibetan doctors will tell you to take it with the boiled water. These pills, but since it is a lung disorder, since it's in the winter time, it's a cold, you can add molasses or add honey, because molasses improves the body heat, and honey makes you warm, not just warm, but feels so light. Because in winter time, when you sleep too much, when you feel sleepy due to this winter time effect, then what you need a lightness. So the adding a kind of honey makes your body light and helps digestion, and improves the digestive system, and improves the whole metabolic function. So these are the two main. We often, not just for Ninglung, these are really good as a prophylactic treatment, because agar 8 often is one of our main lung because when we get a patient like cancer patients or any major chronic inflammatory disorders or chronic metabolic disorders, we try to manage the lung. And often in my practice, I prescribe agarate often with all these major problems to balance the lung, because we have to manage the lung, we have to manage the emotion, we have to keep someone positive. And when the heartbeat becomes normal, and when this heartbeat slows down a little bit, uh, especially those who are lung type, it really helps to heal major problems. Even cancer patients, especially the women with the breast cancer, this agar is one of the major kind of a Tibetan herbal combination to help the emotion, because it's very important for chronic problems. People who really feel not just depressed but hopeless, they really have to overcome all these kinds of negativities. So agar 8, or what we call as a Nyinglung 8, is really 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 helpful. And same day is for all, for just to keep your moods up, because there's too much of mood change. When your mood goes down, then the body has a low level of serotonin. So it is kind of a Tibetan, you can say, serotonin pill, as a supplementary. So you can try all these things. Really, really works well. And there are many cases that people really benefited, and many our Tibetan people really believes in these and benefits by taking these herbal combination.
Thank you. I've actually looked at the ingredients in Semde and I noticed molasses. It does include molasses already. And I wanted to
Yeah,
spotlight another of the ingredient in Semde. There's a spiked ginger lily. And, that's already a herb that's well known and used in Ayurveda, Indian traditional medicine. And, it's known for its healing and anti-inflammatory, tonic, restorative, and antibiotic properties. It's been used already in aromatherapy to relieve tension, headaches, chronic fatigue. It just really improves psycho-emotional state, increases concentration, relieves anxiety, and normalizes sleep. And it's sometimes combined with lavender and sage and cinnamon, eucalyptus, cedar and orange. And you already spotlighted nutmeg. Really great healing properties for sleep disorder, insomnia, and anxiety. So thank you. I
yeah.
think there's so much interest
What
what you're eating and what you're
what I
consuming.
want to add here, uh, that the ginger that we have in Semda is the Himalayan ginger, the wild ginger. We call this gacha. Whereas the cultivated ginger that we commonly use in our kitchen, these are two different kinds of species. So in our Semde we use the wild ginger, which is known as Gingiva officinalis, whatever you can call it. But this is the species that we have to collect ourselves from the wild, uh, in the Himalayan regions, and up in above, it grows above 2,000 meters sea level. And I want to add here, as I said in the beginning, it's very important to warm up. So in order to warm up, what is important is you can use this piper longum, and which is long pepper, and then you can use the black pepper, and if possible, the wild ginger. Otherwise, you can use ginger as a drink, as a tea. This is really good in wintertime to warm you up. When your body is warm enough, it is a form of a sunlight. You're generating sunlight energy inside the body, so it improves your digestion. When the digestive heat is good, this is the strength that you require from inside to generate your own sunlight. The heat. What the principle is to generate the heat. When there's enough heat, then you will not suffer from all kinds of problems, especially the depression. When there's less heat is generated, then we suffer from all kinds of problems. So keep warm, not just physically warm, but emotionally warm, mentally warm. Keep warm for everyone. Keep more space for everyone. It's good to interact. It's when in winter time, don't stay alone. If you stay alone and just think alone, and then you have all kinds of problems coming one after other.
Anxious
Then
thoughts and the cycle of anxious thoughts.
it is important to go and consult someone that you trust, that you believe that is more stronger than you, and get the advice and talk with them, and then be with them, and then enjoy the life. So that will also help you to overcome all kinds of seasonal affective depression or disorder, because it's not just, you don't need to find a, s- a single herb or single medicine to treat this. It's a kind of a collective kind of a problem, which where you have to adjust, and you are a very individual person. You just have to find your own way how to treat that. Then this will really help. So this is, I think, very, very important, because we are all different, we all individual. So whatever suits you and whatever benefits you, you really have to look for that.
Thank you. I actually wanted to highlight something that you spoke about, this the difference between the two gingers, and that you cultivate, and you have to find these rare ginger in the Himalayan region. And actually there is a whole year of learning about these plants, isn't it, during your Tibetan medical college and your formal training, which involves actually living up in the Himalayan region and looking for this medicines, learning how to combine it, how to make it. So all Tibetan medicine doctors, through their training, it's a 5-year program with an additional year of clinical practice, actually are trained in identifying these herbs and plants, and combining them and actually making the supplements. So I just wanted to highlight and spotlight that's involved in the training. And you have such an intimate knowledge of the medicines. And a lot of the doctors on my apps, they want to know who I'm getting the medicine from, how large are the pills, because that increases the dosage. They're really, purpose-led, and they really want to ensure that, the medicines, supplements are, of the highest quality and caliber, because, the patients are actually following through with the supplements. And these are available for purchase on our app and on our e-commerce sites on eBay and Amazon. Thank you. So we'll open the floor for any questions for Dr. Amchi Namgyal Qusar. Again, just wanted to repeat, if we could keep it to general questions. I will also start off with a few questions that we've collected, and that'll also give everyone a chance to warm up and be able to assert their questions. The first one is, Amchi Qusar, what about people who are suffering from seasonal affective disorders, and they have an emotional crisis instantly? What are some of the immediate steps they can take before they, consult with a physician or a Tibetan medicine doctor, and when they're alone? What can they do on, kind of, if you could give practical tips, immediate tips that they could take?
Yeah, immediately it's best to keep warm, eat warm food, and then cover up themselves warm. And as I said in the beginning, when they have to go outside, they have to really cover their head properly, so that they don't expose too much to the cold. And when there's a very strong crisis, it's good to start with a deep breathing exercise, you know, that we call this as a, lungro sewa. You just, this 9 breathing exercise, the lungro sewa. It's very good. They call this in the, and alom vilom kind of yoga exercise would be very good. And also, to start with, it's good to practice mindfulness. If they are in a meditation, it's good to practice mindfulness meditation. It's good to eat warm soup, like soup with a nutmeg, and any kind of warm vegetables, especially with the ginger, radish soup, beetroot soup, and with the condiments like cinnamon, and ginger, as well as the black pepper, the cloves, such kind of it's good to it's good to use warm spices in wintertime. In the West, you often are used to using you know spices which are warm, not warm enough, quite cold, like lavender and things, stuff like that. Whatever that you use in oregano, I think these are quite cold, cooling things. It's good. It's good, to cool up in winter time. But in winter time, it's better to use Indian spices to warm you up, and then take some soup which contains a little bit of butter in it. Just warm up, and do strong exercise. And then when you don't have any other things, then it's good to start with some, as I said in the beginning, this black pepper, ginger, and and long pepper kind of a combination. Just make a paste, and drink it with the milk. Drink and add some honey with it. And keep warm. You can use nowadays. You have in the West. You have warm heating system. If here in India we don't have the heating system, the the common heating system. So it's very difficult for us to manage like this in winter time. And we have good sunshine. That's a good thing. Otherwise, it's difficult. So if it's warm inside the house, just you have to warm up yourself. Don't feel vulnerable. Don't get submit to this kind of emotional crisis easily. Try to make positive. Think positive. You just start your morning prayer with opening space for everyone. Just pray for the health and well-being of everyone in the morning. This will open the space, and this will make you stronger. If you just pray and think only for yourself, you become very weak. If you open a space for everyone, you become very strong.
It's one of those Buddhist roots of Tibetan medicine, isn't it? The compassion and thinking of
Yeah,
others, actually
yeah,
makes you, it's embedding gratefulness and and embedding that positivity, which I think a lot of people see with the Tibetan culture. Yeah.
yes, yeah. This is very important. We have to generate love and compassion, and then not just generating love and compassion, but also joy of generating that. And at the same time, there should be a kind of equanimity. Don't think, because self-cherishing time is the one problem that we feel vulnerable and we go into crisis. If we include everyone, whether it's your parents or whether it's your family members or relatives or friends, if you include everyone, even your enemies, in your prayers, that makes you stronger. This gives more space inside our body system, so that helps you to overcome these kinds of immediate crises.
Thank you. We'll actually take a question that's come in. Do you recommend same-day medicine for insomnia in general, or
Yeah, yeah,
are
yeah, yeah, definitely. Insomnia often, it's again a lung disorder, and often insomnia is excessive lung. So Semde is really a good one of the, not just Semde, even we normally prescribe Semde and Agar 8, Semde in the morning and Agar 8 at night. Both can work together for insomnia. And then also we in my practice, I do moxa as well as acupuncture. I have devised my own kind of acupuncture needle points to treat insomnia and anxiety as well as panic disorders. So yeah, Samta is really good.
Thank you. Another question came in earlier. How long does it take for these supplements to take effect?
Yeah, it depends on individual patient. Sometimes it can get effect in 3 days, sometimes within a week. So it depends on individual patients, but definitely after 2 weeks, it starts to show up the effect. If it's difficult, after 2 weeks, definitely they show the effect.
And we've got another new question coming in from Facebook, where this is being streamed live. I'm sorry if I pronounced it incorrectly. It says, will solar qigong or tumo be beneficial to generate needed heat? So the Chinese exercise system.
Solar what?
Solar qigong or tumo?
Tumo.
Qigong.
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 Yeah, Qigong.
Yes.
Yeah.
Thank you.
Yeah, definitely. Qigong, Tai Chi, and all these are really good because this helps to maintain the lung. The Qi is the lung. In Tibetan medicine, it's Ilung. In Chinese, they call Qi, that the subtle energy. So this, Qigong and definitely tummo practice generates heat. So, it's of course not for everyone, but for those who have practice experience for many years, it definitely helps to, this tummo helps to, overcome this heat problem.
Are there any other questions via Zoom or Facebook? Oh, yes. Oh, from YouTube. Where can we get these medicines? So I'll take this question. You can download our app, Medicine Buddha, and we have these available on our shop. These are from Amchi Qusar's clinic, and we have cataloged them by EU regulatory systems, so you know exactly what are the ingredients and expiry date, and we dispatch them from London. But what we would really recommend, rather than buying just over the counter of these supplements, is actually get a consultation with a Tibetan medicine doctor like Amchi Qusar on the app, so he can calibrate one exactly for your condition and your circumstances. And then the supplements, when we send out, are actually personalized. So they would literally say something like Semday for Jane Smith, 2 Semday in the morning, half an hour after breakfast, Ninglung, 3 pills after dinner. So that is, I would recommend actually a better approach. And Amchi Qusar is on the app available for a consultation, and it's a video consultation on the app. And then immediately afterwards, he'll be able to make the supplement suggestions, which then pop up on our tab as My Supplements, and it's very easy to purchase it. So it really is an integrated one-stop shop. In terms of the external therapies, if you Google any Tibetan medicine doctor in your locality, they will be able to execute the external therapies. I know Menla said that they have all these external therapies. They've been trained by a very famous Tibetan medicine doctor, Amji Nirachana in the Tibetan medicine tradition. And it's very true to the Tibetan medicine roots, delivered in a very true and authentic manner. Are there any other questions coming on either Zoom, Facebook, or YouTube?
Those are the questions we got from the simulcast. So anyone in Zoom, would you like to help close us out with one last question? Anyone in the room? Otherwise, we can go back to you, Tenzin. Yeah, it doesn't look like anyone's raising their hands. So, yeah.
Well, just to give the opportunity, you can also reach us online via our social media in case you have a question that comes up later, and then we'll directly reach out to Amchi Qusar. We're on Instagram and Facebook as Medicine Buddha app. And of course, please download our app and sign up to our newsletter to be in touch with any exciting developments or news we share. We share a lot of free content just to help promote Tibetan medicine and Tibetan healing. So thank you so much. I'd like to thank firstly Amchi Qusar, who's dedicated all this time at 5:30 o'clock in the morning on top of his busy practice, and hours spent actually preparing this presentation, and so generously sharing his expertise over 30 years, so insightful and so valuable. And, because this is now being live cast and recorded, your help is actually being, expanded even more with the reach of technology. I'd like to thank Justin for hosting this and initiating this, Bob Thurman, Michael Burbank at Tibet House, and Menla. Thank you so much. Hope you've enjoyed it. Hope there's some nuggets of information that'll really help you with your healing going forward. What I keep hearing, and it's resounding in me, is that positivity, that that seems to be kind of the foundation that you need to carry through to deal with your depression, to deal with your seasonal affective disorder, depression. Are there any last words, Amjala?
Well, just want to thank you, first of all, Medola, for organizing this. Uh, and also, I would like to thank Tibet House, Bob Thurman, and also Justin for hosting this. And would like to thank everyone who joined this Zoom meeting. And I hope you understand and you learn something a bit of Tibetan medicine theory, and it's a treatment for season affective disorders. And I hope really that people be happy and healthy all over the world, and may peace be prevail on this earth. Thank you so much, and thank you.
Thank you. Actually, as a final point, I wanted to point out to some of the resources on Tibetan medicine. There's a ton of information online, but actually for specialist knowledge, and these are books I've been reading over the last few months. This one was recommended by Amchi Qusar, and that's Tibetan Buddhist Medicine Psychiatry, The Diamond Healing by Terry Clifford. I spoke about Amchi Nida Chanatsangla. He's written a Tibetan book on health. There's this great book called Healing Anxiety. All these available on Amazon. And then, Dr. Amji Yishi Tunden, he's written this book on healing from the source. So please get in touch with us via our social media channels. If there's any topics that you would find interesting, we're going to continue working with Tibet House and Menla on a series of talks, and we wanted to actually benefit the most people. So if there are any topics that you find particularly helpful or insightful, please send it our way. And if we hear a majority of people asking for certain topics, we'll try our best to match it with also a doctor who specializes in that, just to add the value and bring real subject matter experts. And that was my whole vision of the Medicine Buddha app, is to promote Tibetan medicine with excellence in Tibetan culture, but also, elevate the whole standards of Tibetan medicine doctors and Tibetan medicine itself. So thank you so much again, Amchi Qusar, for such a great session and an inaugural session. And let's continue speaking and promoting Tibetan healing. Thank you so much, and have a good evening, everyone.
Thank you, everyone. Any of the mentioned titles will include in the Teachable, and I'll touch base with Tenzin to see if we can make the slides available as well. We want to thank you again. And if you have any suggestions for possible topics, we hope to do this every month or so on Medicine Buddha Days. So please send us suggestions, and the replay will be posted in about a half an hour, but you can enjoy it right away on YouTube or on Facebook. Tashi Delek, and thanks for tuning in, everyone.
Goodbye.
Thank you both. Let me just replace your spotlights.
Hello.
We love the dogs singing to be brought out. It was one of the blessings of this session. Thank you. What are their names?
Jackie, Husky, and I have two. Another is Tina and Jackie.
They're very Western names.
Huh?
Very Western names.
Yeah, Tina is like Indian name. I don't know.